Congresswoman Debbie Dingell, how are you doing?
Nolan, did you ever think, would you have bet a penny that I could stay home for 19 days without any physical contact?
Not 19 hours. Not 19 hours. You're someone who's at 5, 6, 7, 8 events a day, and you've been home
that's
for
by
19
10 o'clock
straight
in the
days?
morning. I have told everybody I hate the word social distancing. We've got to lose that word. We need to call it physical distancing because that's what we need to do. Yeah. Right now, we all have a job to do. And for most of us, our job is to stay home. And leaders lead, and I'm leading, even though I'm going crazy.
Well, and that's what I wanted to ask. I mean, this is a time when a lot of decisions have to be made. Our government has to keep going. It can't shut down. How is Congress doing its job in this period when you can't gather together?
Well, you and I figured out how to talk to each other on Zoom. And I've learned a lot of new technology in the last couple of weeks. And if you had asked me if I'd ever been able to do this by myself, and I truly have been by myself. When I came home from that last vote on the third tranche, I filed for re-election and came in this house and have been here. But I'm on the phone at 6 a.m. I'm frequently on the phone to midnight. And I've learned how to use Zoom, which is what you and I are using today. I've learned webinar, I've learned Skype, and you talk to each other. I'm on endless conference calls. I'm actually more tired at the end of the day than I was when I was in the Congress walking around and getting exercise.
But what if you have to actually take a vote on something? If there's another stimulus needed, you'll have to go back?
We will go back. And we'll do it under very sanitary, healthy practice conditions.
So there's no provision for meeting like this electronically, the way other organizations and boards and groups are meeting? You can't do this by Skype or Zoom. You have to physically be present?
We cannot. So last week it wasn't clear if we would need to take a vote. I did not go back to Washington because I'd had a staff member who had a fever and the symptoms, waited 2 weeks to get her test results. They were not back by Friday. And on an abundance of caution, which is what we all need to do, I stayed put. But we had a study that Jim McGovern, who's the chair of the Rules Committee, did an in-depth study. And the fact of the matter is, to even change the rules, we will have to go back. I think a lot of people, Nolan, never thought we'd experience what we're experiencing in our life. And a lot of people haven't wanted to make contingency plans or create national stockpiles or see the importance why they matter. I think we have generations of people that will understand why they matter now.
So you think this will change things?
I think there's a lot of discussion. I think there's some people. I was not for remote voting. I think you could very easily slide into not talking to each other, not having thoughtful conversations. I think that interaction, and I think remote voting should only be for continuity of government and making sure that critical things that have to be done in a crisis is done. But I think we got to talk it through now.
We were caught unprepared by this crisis, do you think, Debbie?
Yeah, I want to be honest. I think a lot of the national stockpiles should have been in better shape. And I'm not going to point fingers. I think that, I was one of the early people. Everybody was making fun of me, including you, when I started talking about the coronavirus in January. And I asked questions about the Detroit airport and shouldn't we be instituting, and nobody took it seriously. And I'm telling you, a lot of people, both sides of the aisle, a lot of our friends that you and I know, thought that I was maybe beginning to go a bit overboard. I don't think anybody could have envisioned I didn't envision, and I was talking about it, what we are experiencing right now. And so, no, I think this is a once in a several generation. 1917 was the last time we saw something this traumatic happen around the world, and we need to know what can happen.
Debbie, do you feel our national infrastructure is engaged now the way it should be?
Not to the extent that I would like to see it. I think the president needs to use the Defense Production Act, period. I think he did invoke it for he invoked it only for General Motors last Friday. And, I think all the autos it's been very difficult for the autos the last couple of weeks. I have
Yeah.
spent a great deal of time I actually talk to every auto every day and talk to the UAW every day. And, they are in many ways essential. They know their role in the economy, but at some point, how could you assure that the plants were safe?
Yeah.
Chrysler's had 7 workers who have died. Ford has had 4 or 5 workers. Quite frankly, people at Solidarity House, 1 person has died. And we're seeing deaths in this area. Nolan, I've known 12 people that have died in the last 10 days. All of us are really, and not all of them have been because of COVID.
Right.
But we've got to figure out, so they're stepping up. Now they're going back to work. We've got this shortage of PPE, personal protection equipment, which should not be. We've got our doctors and nurses on the front line scared to death. So General Motors was working with Ventec on trying to get the ventilators made. Ford has announced last week, I'm very proud of the 12th district. We're producing ventilators at Ipsy, Willow Run, home of the Rosies. They're going to be doing N95, the respirator masks at Flat Rock, and they're coming online. We'll get a lot of those out, not only to local hospitals, but throughout the country. Chrysler's doing masks. Carhartt is doing gowns and gloves. And so are lots of suppliers all around Michigan. I know the 12 so well, but we're bringing a lot of volume, but it's still going to be a couple of weeks.
So we've been calling it the arsenal of health, and private industry, private businesses have been mobilizing to meet this need, particularly the automakers.
And they have. But what you do need is somebody coordinating it. Right now, we're still watching governors bid against each other. I'll tell you one story. 3 of our hospital systems here, I'm not going to tell you which ones, went in together to get masks from China. Those masks normally cost 50 cents. They were charged $8.50 per mask, and they had to pay $1 million to fly them over. We need to, and so what we need at the federal government level, and I have to say, it's easy to be critical, and we need, at a time when this is over, to look and examine what was ready, what wasn't, what went right, what didn't go wrong. But right now, FEMA needs to take over the supply chain across the country. Governors are still bidding against each other. As hotspots come, we're one of the hotspots. How do you get ventilators there? But even though we're a hotspot, we have close to 10,000 people with active COVID. New York City has 82,000 yesterday. New Jersey has 22,000. So everybody's competing for those supplies. Illinois is becoming a hotspot. We're competing with the governor there. And in Ohio, DeWine, we need to not have price gouging. We need somebody managing the system and getting the supplies that are needed out there.
So, Congresswoman, you mentioned that we need to examine this when it's over, examine what went right, what went wrong. House Speaker Nancy Pelosi suggested on CNN the other night that we might need to convene, she might want to convene new hearings into what she called the denials and delays of the Trump administration. Do you really think there's an appetite in this country for more hearings of this sort?
I think we can't be partisan right now. I've said this 1,000 times. We have a general election in November, and there will come a time when we need to talk about who should be the candidate. I want to be really clear, Nolan, that our delegation is working in a very bipartisan way. When I heard about Trinity Health Systems yesterday, and they are having serious cash flow issues, but they're also making sure that their hospitals are open. They're transferring their frontline workers over there. The first person I called was Fred Upton. And we immediately got on the phone with the governor's office together, the hospitals together. He got HHS. I was talking to the governor's staff. And our whole delegation's been doing that. We each have an area we're on different committees. We say, okay, what's got to get done? And then we're on the phone. Alyssa knows that FEMA, procurement, Defense Department cold. She's working on those issues.
Alyssa
Slotkin. Paul Mitchell dug into the problem of why some of the supplies that weren't coming for FEMA that had said to been delivered weren't. He dug in. We're all working together and talk several times a day.
But there will have to be a campaign at some point. There'll have to be an election. How do you campaign in this era of quarantine?
Well, for right now, for the next month, I'm going to tell you, I tell everybody, stay home if that's your job. We have to kill this virus first. It is an invisible enemy that isn't targeting any of us by nationality or political party. And a virus doesn't know a state boundary or a country boundary. And we can revive an economy, but we can't bring a life back. So we all got to work together right now to attack this enemy. And, you know, we may be in quarantine, or we may be staying at home for the month of May as well. And when we do go back, we got to really rethink. I was having a debate with a Democrat today, not a Republican, about whether we shake hands again.
Never.
I'm putting my hands to my heart. We need to think about what our new customs are. How, you know, when we go to these crazy receptions, how do you put distance? How do you not breathe on each other?
Right.
The doctors are already telling us, the scientists, this is going to be around for a while. Hopefully this summer, it's going to die down. We're going to all stay home and mitigate it. But so let's get through this, and then we'll run campaigns, and we'll do a lot of it virtually. We're going to do a lot of it online, but you also we'll have gatherings. You'll talk to people like we used to. I miss the farmers market. You know, I did a lot of work at those farmers markets, but we got to distance, physical
And it
distance.
will be different. I've been telling people, even after this is over, I want folks to stay 6 feet away from me forever. But Debbie, back to politics. We've got a Democratic convention coming up in, you know, just a few months, July 13th in Milwaukee.
To August 17th.
Today.
It happened in the last hour. The Democratic convention in July has been changed from July to August 17th.
You're breaking news for us now. I hadn't heard that. Okay, so you believe you'll get these, I know 14 primaries have been postponed already. Do you believe you'll get them all in before the convention and be able to go to Milwaukee in August now and do a traditional convention? Or
I don't think it can be a
altered?
traditional convention. I want to do reality checks right now with people.
Okay.
I was elected to represent my people, and if my presence in Wisconsin means that I help democracy, then I'll be there. But if I'm not needed, I'm staying home and working with people. I'm going to stay home and talk to people. I think these primaries do matter. I think that is where, at the grassroots level, that people can participate. But now more than ever, we changed our process here in Michigan. There's no excuse. Paper ballot, absentee ballots. I've been home too long. Absentee voter ballots. For the May 12th election in Michigan, the governors said that every voter needs to be mailed an AV ballot. We need to sign up. Everybody that's home, I have two messages for everybody that's stuck at home right now. One, do your census. Got to do the census. Yesterday was the official census day. I do everything people tell me to do. My mail sits in the garage for at least 3 days, but actually I keep it there a week. But I had 2 mailings. I went in, I filled out my census. You can do that, and we need to do that so we have an accurate, and you can call your clerk's office, you can go online, you can apply for an absentee ballot. Get on that permanent list so that we all participate.
Now, Debbie Dingell, I know you've been stuck at home, but are you hearing from your constituents still? And if so, what's on their mind? What is their mood?
So Nolan, I do several things a day. I mean, I have new rituals, but staying in touch really matters. So it's probably, it may be better, but I really miss the farmer's market and my Starbucks, and just hearing from even my guys who can be kind of grumpy some mornings. I miss them a lot. But I do a posting every morning. I do a blog, and people will send me personal notes or post on both my Facebook pages. I do my personal and then my official page. I do an update every day. And, people have been nice, but people don't hesitate to tell me what they think. I do a town hall meeting every Wednesday. We announce it, we put out releases, I post it on all my social media, and people can ask to be called, and we also dial 40,000 people and ask them to participate.
So what's your sense of the mood of your district? What do people want?
I have scared people. I think the small business owners and the restaurant owners are really worried. I mean, I've had somebody, I'm not going to give you the name of it, but you've heard of it, had to lay off 5 managers and 100 employees, was in tears. A lot of my smaller restaurants are, hoping they're going to be able to reopen the door, but not only are they worried about their businesses, but they're worried about their employees. Yeah. This week, I'm getting a lot more workers as April 1st approached and people had mortgages and rents to pay. What did they do? You help people. Call banks, call car payments. And a lot of the banks, the car companies are all extending credit, trying to help people and be that. The unemployment side, people are applying. It's crashed. You're telling them how to go back in again. People want to know when their $1,200 payment is coming. The seniors were very confused and outraged about having to file a tax return. The administration heard people at the grassroots level changed that requirement last night. We're moving to, a lot of people still have questions about, how do I get it? What do I do? And you hear that fear, concern, and anxiety, but the sheer reality of us being home, what's happening to our jobs, how those things are now what you're beginning to hear about more each day.
So finally, Debbie Dingell, you're hearing from all those people, particularly the small business people, and your district is chock full of small businesses. Are we doing enough for those folks and their employees? And what more should we be doing?
We'll have a 4th bill, tranche as we call it, that we're already starting to work on. There are some very clear things that we have to do that I think there won't be disagreement on, which is we're going to have to give monies to the state and local governments who have really been hit by this pandemic and are the front line. You see our governors are in bidding wars against each other for PPE equipment and having to pay for it, but our public health departments, our local governments have been devastated. Honestly, Nolan, the House bill and the 3rd bill had water, helping to ensure that every American has water, just turned on. How do you tell people to wash their hands, which is the #1 thing we can do to prevent the spread of this virus if you don't have water? Rashida Tlaib and I have a bill that was part of the 3rd tranche that Energy and Commerce and Transportation and Infrastructure are supporting for the 4th tranche. What are we going to do for seniors and long-term health care? Yeah. We have that side, but then we need to look at the economic parts of it too. And right now, you got to listen to the small businesses too. Those loans that they're getting right now, if they're helping take care of workers, are going to become grants. How do we help our hospital systems? People don't understand that while they're working and their hospitals are full, their income's not coming in. They don't have revenue. So they're trying to figure out how they're going to pay for all this equipment and pay those doctors and nurses that should be getting hazard pay for what they're doing.
Oh, I absolutely agree with that. I heard my sister is a nurse in rural Kentucky, and I heard from her today, and the conditions in these rural hospitals particularly are just awful for the healthcare workers, for the nurses and the doctors. They're completely out of protective gear. But Debbie, speaking of paying for things, we don't have the money we're spending on this. We're borrowing this money, putting it on the credit card. Is there any conversation amongst your colleagues in Congress about austerity in other areas of the budget to help pay for this?
I think a lot of people are worried about the impact on the budget. But I think there's a consensus, not to say that there are not people that, are like, how much more are we going to do? But I want to say this to you right now, making sure that we defeat this virus, that we keep our economy healthy, is got to be our #1 priority. And then, yes, what programs can we cut? But down the road, I'll tell you something that I feel everybody agrees on. Finally, we've been talking about the need to fix our broken infrastructure.
Right.
We're seeing the cost of having not repaired it. So I think Republicans and Democrats are going to agree that we need to have an infrastructure bill, and that's going to create jobs. I'll tell you what else is going to happen, Nolan. We've also witnessed firsthand what happens when you outsource the supply system, and when 90% of your drugs are being made in China, or the generic drugs are being, or this equipment. We, for our national security, are going to have to bring jobs back home.
We need to bring it home.
We need to bring the supply chain back home, and that's going to create jobs too.
Congresswoman Debbie Dingell, thank you for joining us on One Detroit.
Thank you.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.